right. Well, thank you everybody for joining us. This is the last in our 3-part series, Living Longer, Stronger, and Better. And of course, we saved the best for last. Mike Mangini is the director of our physical therapy department. Don't let Charlie and Chrissy hear that I just said we saved the best for last. Mike's been with us for quite some time and has certainly gained a reputation as a very knowledgeable source of information. So you're all really lucky to hear from him today. And I am going to turn it over to Mike, and he's going to take you through the presentation. Thanks for joining us. Good to go.
All right. Well, thank you so much, Stacy, and welcome everybody. Thank you for spending a little time with me today. I'm going to speak regarding fall prevention and how to improve your balance and simple strategies that you can do to maintain independence and hopefully prevent falls. We're going to get save questions till the end, and I'm just going to get started. So again, my name is Michael Mangini. I am the Director of Physical Therapy here. I've been here since 1997, and I started when I was 10. So I think that makes me about 37. So again, why are we here? We're here for fall prevention and goals to improve mobility and confidence. So first we should define what a fall is. So what is a fall? And I would say a fall is mostly defined as an unintended loss of balance. I think one of the things that happens is there are times we are falling, but not reporting it or classifying it as a fall. So if I walk and I lose my balance and I fall into the wall or a doorway and it interrupts my contact with the ground, that's still a fall. And I call that an almost fall. Nonetheless, it's probably not going to be reported or classified as a falls. In general, falls are underreported. One of the issues with reporting a fall is that, if my mom tells me she fell, I'm going to probably get nervous and, ask her a lot of questions and tell her to go to the doctor, and she's probably not going to want to tell me. So again, falls are generally underreported. So whatever statistics we have, I would say they're likely to be conservative statistics. Some of the risk factors for falling include medical conditions that affect and may create some confusion, medical conditions that affect your mobility, poor vision, muscle weakness, loss of sensation in your legs, stoop or kyphotic posture, arthritic pain in the lower extremities, taking 3 or more medications, as well as some environmental hazards, things in and around your house, a slow or abnormal walking pattern, poor flexibility, or poor shoes. In my opinion, we're not going to see this in the literature, we're not going to read this in the data, and I've been a PT now for 31 years, and if I ask people, so when you fell, what was happening? What was going on? Tell me a little bit about your fall. One of the things I hear a lot of times is I was rushing. I was kind of moving quickly. I was trying to get something done. So again, sort of rushing to do something, as well as being distracted or trying to multitask. Sort of like driving and looking at your cell phone. We know that's not a good idea. Our brain really focuses well on one thing. So I hear that again. I was multitasking. I was trying to bring my groceries in and the phone rang or whatever. So again, many times when we're doing multiple things at once or trying to do too much at once, it's going to affect our focus. So again, not something that we'll see in the literature, but I think worth mentioning. What are some predictors of falls? Number one is really a prior history of falls. So the past, in a way, can predict the future. Use of a walking device, something they call self-efficacy or fear. So if somebody has poor confidence and doesn't believe in their own mobility skills, it really impacts sort of our emotional state, affects our ability to perform functionally and physically. As well as the failure to perform well on, maybe a performance or a physical test, as well as age. As we get older, likely to have falls or loss of balance. Some of the consequences of falling, simple orthopedic injuries, strains and sprains, fractures, emotional trauma and fear, sort of a PTSD. And the worst one, of course, is death. Some of the latest data that's come out is really shocking. What they're finding now with research is that more and more people are actually dying from falls. So there are right now 30,000 people a year above 65 that die from a result of a fall. And the expectation in 9 more years that that number is going to almost double. So one of the things we do as physical therapists is something called clinical screening. So we use tests, and when we do these tests or these screening tests, we're trying to capture as many people as we can who might be at risk. We want a good sensitivity, and these 3 simple questions are very good and simple. Do you feel unsteady when you stand or walk? Do you worry about falling? And have you fallen in the past year? So if any one of those questions is a yes, the recommendation is a formal fall risk screening assessment with a physical therapist or an occupational therapist. So I'm going to give you guys, some simple things to think about and to consider to improve your balance and prevent falls. One of the things is to review your medications with your doctor or your pharmacist. Many times we get medications, there's interaction effects, maybe the dosage could be reduced. Always a good idea to review with your pharmacist or your physician and make sure that you're not taking any more medication than you need. There are some medications that cause dizziness. There are some medications that will really affect your balance. One of the common ones is, say, Ambien. We use Ambien to sleep. Ambien makes you groggy. You can get up in the middle of the night, lose your balance and fall. So, medications all have side effects, and those side effects can really affect your balance. Having regular eye exams. So seeing your optometrist, your ophthalmologist. If you wear glasses, change and replace those glasses as needed. Our vision does change over time. So this is an important, simple thing we can do. Performing a home hazard assessment, removing clutter and tripping hazards. There are so many things in and around our home that we just sort of get used to. There they are, they've always been here, but they are tripping hazards. In my house, they're dog toys. I have dog toys all over my kitchen, and sometimes I just forget they're there. And it's wires, loose carpets, poor lighting, very simple things that we can do sometimes to reduce fall risk. Wearing proper and sensible shoes. So what does that really mean? Proper sensible shoes ideally would be, for most people, a thin-soled shoe. If you wear a shoe that's very thick, it affects your ability to clear the ground. And one of the things that happen as we age is we lose the ability to pick our feet up some, when we lose some flexibility in our ankles. So we have trouble clearing the ground, so we trip on things like thresholds. So a thin-soled shoe reduces that risk because it's reducing the depth, essentially of your foot. And if you're going to wear slippers in the house, making sure they're rubber soled so they're not likely to cause a slip. Of course, managing your medical conditions appropriately. So if you're a diabetic, monitoring your blood sugars. If you've got arthritic conditions, maybe you need to see a rheumatologist once a year. So any medical condition that you have, again, is something that you want to actively manage. Sounds simple, improve your posture. We're all fighting gravity. As we get older, we tend to see people stoop. And as we bend forward, our center of gravity changes. Our visual orientation changes. So again, this is a big risk factor for falling. So improving your posture, which could mean, exercise. It could be just trying to use better chairs. It could just be saying, hey, I'm going to sit up a little straighter during the day and not stoop over when I read. But the posture I'm really thinking of is your upper back, what we call kyphosis, where we stoop forward, our head comes forward, and then our eyes come up to sea level. So again, an important factor for balance. So in terms of what I mentioned before in self-efficacy and confidence, they've done lots of research and they found that given equal physical skills, so if we take a group of people and we test them, and we test their mobility skills and their strength, and we find that they're pretty much the same, and then we test their confidence and their self-efficacy, and we find maybe one group that has low confidence in their mobility skills and one group that has normal or high confidence. And then we follow these people over time. The people with poor confidence, poor self-efficacy are much more likely to fall. So again, there's more to balance than just physical strength and flexibility. So this confidence, as they describe, can be measured and it can be improved. And that's where sometimes mental health services, issues like anxiety, depression, or if you've had a fall and you're anxious, but I hear from patients all day, I don't have confidence, I really fear falling. So improving your confidence can be a very big deal in terms of preventing a fall. The big one for me is, again, participating in an exercise program and maintaining an active lifestyle. And an exercise program could be anything. It could be walking, it could be Tai Chi, it could be something that you enjoy, swimming. So again, staying fit, staying healthy, obviously very important. One thing also to be considered is to be tested. There are, like we mentioned, tests that we do for measuring confidence, physical tests that we do to assess strength and mobility and balance. And once we identify impairments, whether they're strength impairments, posture impairments, mobility impairments, there are exercises or what we call targeted balance exercises to improve your functional ability. So beyond what I would call simple exercise or recreational walking or bike riding, these targeted exercises, these targeted balance exercises are very important. When they've done research and they find that exercise is very helpful for improving patients' balance, what they have found is the more critical thing is to combine regular exercise with targeted balance exercises. So it's not just exercise in general, it's balance training plus exercise. It's better than one or the other. So the sort of the combination of the two is better than one by itself. So if you screen positive and you have some impairments, our recommendation is to initiate physical therapy. As I just discussed, we would incorporate strength, balance, flexibility exercises, and obviously a home program. Most of this is done at home. In the clinic, we do some guided exercises and training and make sure your technique is good. And of course, the most important thing when you do balance exercises, you don't fall. So we want to make sure that the exercises are appropriately challenging, not too difficult. But the focus is really to get someone on a solid home exercise program, things that they can do in their house without equipment. One of the common questions we'll get is, hey, is this covered by Medicare? So yeah, Medicare covers physical therapy when it's medically necessary, meaning balance is a big deal in fall prevention. It's certainly medically necessary. Requires a skill level of PT, so we're not just doing fitness training. If it's reasonable, meaning that we're not going to see you for 50 visits, so a reasonable number of visits, and it has to involve a physician. So that's really, when we say that Medicare's got a lot of rules, and so those are the simple rules that you have to sort of follow for Medicare. So that's, I was going to tell a joke, but it really wasn't that funny, but I'm going to tell it anyways. And actually, I made it up. So you have to tell me now. It's a question. So there's 4 seasons, right? What's the physical therapist's least favorite season? Fall. I heard it right there. What do you think? I always wanted to be a comedian. All right. Well, that's all I have. I guess I will open it up to questions. I think and Stacy is gonna, facilitate that for me if anybody has.
Absolutely. If anybody that's watching via Zoom wants to ask a particular question, feel free to use the little buttons at the bottom of your screen that say Q&A or chat. And I can either relay them to Mike or they might pop up on his screen so he can
Okay.
see them. So let's give it a couple minutes, but if you have anybody there that wants to ask a question, Mike, you can certainly start off with those.
I'm available for comedy. If you have any questions.
What? I'm wearing these things, I know these are not, but what kind of shoes would you, I have Merrill's, but I'm not wearing them today, but what shoes would you recommend for me? I'm 68 years old.
Okay, so we had a question about what type of shoes would I recommend? It's not necessarily a brand that I would recommend. It's
Right.
really trying to find a thin soled shoe, or sometimes it's called a minimalist footwear. So I'm going to take my shoe off and I'm going to show you an example of, that's a thin sole. So it's not a big, bulky, thick sole. So I wear these to work. But a thin soled shoe, you can kind of spot a mile away. It's not a big cushiony, soft shoe. It's something that, again, would reduce the depth and maybe the difficulty in clearing the ground.
How much does arch support play in the shoe?
Okay, good question. Another one was how much, does an arch support, play in the shoe? And, again, some people do have orthopedic issues, like, hey, I have, plantar fasciitis, or I have foot pain, or I have a bunion. So if there's things you're wearing in your shoes, like inserts or orthotics, you can still wear those in a minimalist shoe or a thin soled shoe. So if an arch support's important to you because it feels good and it helps, support your arch, and, it's something you've always had, that's fine. You can still find a minimalist or a thin soled shoe with a good arch. So the thing that I think is important for the average, let's say older adult, is just to have that part of the sole itself, not be super thick and bulky. It's more on the thin side. I don't know if
So
that
Mike,
answers-
we do have one question from the community, if you have a second.
Okay, I'm just gonna follow up on this first question, or second question.
Go right ahead.
It's more, how do you know if you have appropriate arch support?
Oh, how do you, the question is, how do you know? That's a hard question. I think if you have a specific issue and you're trying to maybe correct, for a fall on, or a low arch, and support the arch of the foot, it sometimes helps to maybe even take if it's possible, take the arch out of the shoe and stand on the inserts, separate from the shoe, and just see if that, picks your arches up some. Other than that, I think it's more by feel, in terms of what feels like it's giving you adequate support. And sometimes those inserts have to be replaced. So, thank you.
So the question in the community is, how do I make an appointment for testing?
Okay, so how do you make an appointment? It's a good question. So our number at here is 860-824-3820. Our front office specialist is Missy, and she can set you up with an appointment. If you are a Medicare recipient, you have to have your doctor refer you within 30 days of starting. So if I started you tomorrow, then within 30 days, I should have something from your physician that it's just a simple order that says physical therapy, whatever he wants to write on that. That's probably the easiest way to get an appointment, is to call Missy at 860-824-3820.
Mike, just to follow up on the arch question and the shoes, is that something that you guys could evaluate for somebody, or is there a specialist in this world that does those kinds of foot and shoe evaluations?
Yeah, I need custom orthotics, so that's something that I do if that is important or part of somebody's care. And our other therapist, James O'Brien, is super knowledgeable when it comes to shoes, whether they're walking shoes, hiking shoes, running shoes, and minimalist footwear. So if there's this really detailed, specific question regarding a shoe, I tend to defer to James.
Okay, good. That's really good information to have. I had a feeling that was it, because I know this is one of James's areas of
Loves
expertise.
shoes, and no matter he saw me in a picture. I went in a race probably 5 years ago, and it was in the newspaper. And there was 100 people in the race, and he saw me in it, and he identified my shoes in his fuzzy photograph. So as I always say, James is he's a shoe expert.
Okay, good to know. Any other questions out there from the community? That's all I have on this end. Anything from your folks there,
Oh,
Mike?
I have one more question.
I have a question about, I have a fear of inclines, not going down them, but going, or not going up them, but going down them.
Okay,
And I know some of that is PTSD because of the 2 falls I had over the last 4 years. How can I get over that fear of going down inclines, whether they're steep or not so steep?
so the question was, you know, for example, I have difficulty walking down an incline. So I guess that we call that a decline. So when you walk downstairs or you walk down an incline, there's some PTSD or some fear over that. How do you get over that? And I'll give you a simple answer to a complex question. You know, so part of what I would want to do is do something what I would call like a graded exposure. So I would give you sort of an introduction to that, but on a safe level, give you an opportunity to practice and be successful. You know, and as you develop strength and confidence in your own skill, we would make it a little harder. And then eventually you know, you get to do the, you know, thing. It's like, hey, I want to run. Well, we got to walk first,
Right.
and then we got to walk fast, then we got to jog, then we can run. So the same thing with something like that. It's a, you know, a motor skill that requires, you know, strength, balance, confidence. And walking down an incline, like walking down a flight of stairs, is much harder than walking up. So we would give you opportunities to practice something either simple or similar with, you know, safely and with success. And then as time passes, you know, somebody's confidence and physical abilities get better, and then hopefully, you know, you feel, you know, more comfortable with it.
Right. Well, I've been challenging myself here at the lodge for the last few weeks, trying to go down the staircase here, not up it, but go down it. I hang under the railing, but getting more confidence going down that stairwell.
Yeah, and some of it is practicing it, obviously, and getting comfortable, but making it safe. And I think that's a great idea. You're doing it, you know, starting to feel better about it.
Thank you, Mike.
That's a great question. Yeah, thank you.
Those are actually all really great questions, and I'm so glad that everybody's asking them. We're going to give it one more second just to make sure that we're answering them all. And if anybody has any others, just let Mike or myself know. So while we wait, if you missed our previous lectures, towards the end of December, we're going to be doing a little promotion where you will be able to watch them for the winter time on our YouTube channel. And so I will be sending out an email with those links and the opportunity to do that. So if you missed Chrissy, or you missed Charlie, or you missed another one we did by Joan Roche, or if you have friends that would like to access any of those, even if they weren't registered, you'll be able to do that shortly. So keep an eye out for that. And if you ever have any ideas of who you'd like us to feature next time, or if there's a particular specialty or topic you're interested in, please let me know, because we're already starting to plan for the spring. We'll take a little break for December and probably January, but we're already starting to plan for the spring. So if you have any specific topics or ideas, feel free to let me know and we'll work those in. So thank you for attending. Thank you for your time. If you have any questions that you have off camera that you don't want to do now, or you get them later, you can reach Mike at 860-824-3820 or mmangini@gearcares.org. Mike, thanks so much for doing your lecture with us today and sharing some of your wealth of knowledge.
Well, thank you, Stacy. Thanks, everybody, for coming.
Bye-bye.
Thank you.